WBOE.
Hey, how's it going? How's it going? This is Dr. Brown. How you feeling?
I'm doing all right, Dr. Brown.
All right. Sounds good. So I guess we're ready for another exciting episode of Health Facts. Like, look out.
Yes, sir. Yes,
Okay.
sir. Give me a second. I'll put you on.
All right. Sounds like a plan.
And ladies and gentlemen, that was the bully base. God is still in charge here at WBOE. Ladies and gentlemen, it's 12 after 12:15 right now. It's time now for the health fact with Brother Den, Dr. Brown.
All right. Thank you for that introduction. I really love it. Good afternoon, listeners. You're locked into WVOE 1590 AM, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. All right. We got another show going on here today. So what's so the topic we're gonna be going over today. Well, I guess not really a new topic. It's an oldie but goodie. But one thing I've learned in life is that especially when whether you're teaching, in school or you're teaching in the clinic or just talking to folks, is sometimes you have to repeat things. Sometimes we have to repeat things, go over the same thing over and over again. And when it comes to high blood pressure, that is definitely a place where we want to go over things over and over again. Make sure it's fresh in your mind. Make sure we hopefully cover something that maybe you weren't able to learn, you didn't know about before. So that's our goal sometimes when we cover topics that we covered in the past, to give you hopefully a fresh perspective on a topic that's near and dear, at least to my heart and to my profession. Okay, so today on today's health facts, we're actually going to go over high blood. Guess what? High blood pressure. Yeah, we're going to go back over high blood pressure, and we're going to talk about top 10 things you need to know about high blood pressure. And the reason I chose this is because there are a lot of things there's a lot of things about high blood pressure that I that are kind of they're kind of nuanced, really. They're little tricks of the trade, or little, I call them secrets. I don't know if secrets is the right word, that a lot of people just don't know about high blood pressure. Those of us that are in the field know it, and we use it a lot because that's how we were trained, that's how we were educated. But then you talk around and you realize a lot of people don't know this, and this could be other physicians that also don't know some of these intricate facts about high blood pressure. So we're going to go over some of this stuff here, right? So as we continue our conversation about high blood pressure, also called hypertension, we want to let you know, be- because high blood pressure is important. Blood pressure is just important. It's just really important. It's one of the leading causes of strokes. One of the leading causes of cardiovascular disease, strokes, kidney failure. So because of that, we want to go over some facts that you may not know about. So there are things such as, the wrong blood pressure cuff can give a false reading. I think another one which is popular these days is that these energy drinks that everybody keeps drinking can raise your blood pressure, and that actually if you're talking while during a blood pressure check, it actually can sometimes change the numbers. So we're going to go over the top 10 things you need to know about high blood pressure and blood pressure management, because these little things do make a difference. Okay, and so these are practical, real world tips that a lot of people have never been taught or may not never have heard about. Okay, because and trust me, these small details matter. And of course, as a blood pressure specialist, I know this, but I want to make sure I share this with you, right? So that when you know better, you can do better. Okay, so we want to make sure we talk about that. And and because if you think about it, according to the CDC, nearly half the adults in America have high blood pressure, and that number is actually a little higher for African Americans. African Americans have one of the highest rates of high blood pressure in the world. Okay, but you have more control than you think. So make sure you grab a notebook, or if you're watching this, make sure you watch a recording of it. So tell a friend about this, and let's get started, right? So let's start with tip number one. You know, size matters, right? Size matters. So the size, I'm talking about blood pressure cuffs, folks, blood pressure cuffs. So the size of the blood pressure matters. And most people actually don't know about this. Actually, I'll tell you right now, a lot of clinics don't know about this. But the size of the blood pressure cuff absolutely matters. So if the cuff is too small, you can get a false elevated reading of your high blood pressure. Okay, so and that's something that a lot of people just don't know. And if it's too large, the blood pressure may appear falsely low. And this means that sometimes people can get diagnosed incorrectly. You can be over treated for your high blood pressure, or you can be undertreated. Okay. So when it comes to the blood pressure cuff, the cuff really should fit comfortably around the upper arm, and it's actually only the part that inflates is actually only supposed to cover about 80% of the arm. Okay. And this is especially important because many adults, and this is especially for folks that are larger, folks that are overweight, sometimes, a lot of times, they will have this too small of a blood pressure cuff, and guess what happens? They get an artificially elevated blood pressure reading. Looks like we got a post here from Dwayne Muhammad. Hey, Dwayne, how's it going? Thanks for tuning in. We really appreciate that. Okay, I like that. Thank you. Appreciate it. So, so we got, so yeah, so that's it. So like I said, yeah, so when it comes to blood pressure cuff, if you get an elevated reading and you don't think you have blood pressure, or especially if it's your initial blood pressure readings, ask them, is it the proper size cuff? Because sometimes this can be a cue. Oh man, let's go and see if we got a larger cuff, where they can get a larger cuff, recheck the blood pressure, and sometimes that makes a difference in there. Okay, and so one of the questions I want to ask people, and that is, have you ever checked whether the cuff being used on you is actually the right sized cuff? So always make sure you check on that. And if you get a new blood pressure machine, take it to your doctor's office. Whenever you go in there for the checkup, say, hey, because I actually have my patients do this anyway. So if I'm treating someone for high blood pressure and they have a home blood pressure machine, I have them come in, and actually I do a comparison reading. I do it with my machine, I do it with their machine, to see what's going on there. And a lot of times during that process, get a chance to see whether or not that cuff is the appropriate size cuff. Okay. All right. So that's number one. Now, that's probably one of the bigger one that a lot of people miss. Number two, and that is, you actually should rest before you take your blood pressure. Okay. And this is a mistake that a lot of people make, and really is a mistake that a lot of clinics make. Because what happens? Okay, so you go into your doctor's office for for your routine visit. The traffic's bad. The kids wouldn't, didn't do what they were supposed to do. You're arguing with a family member on the phone on the way over. Your friend didn't pay you back your money. So all this stuff is going on. You get in there, and like I said, you're a little late, maybe a little late. Or like I said, the person standing in front of you stays a little bit longer. Guess what? You get a little stressed out, and then they, you sit down for a second, and then they get you back into the back room. They check your blood pressure, and the blood pressure is elevated. What happened? Okay, so you've been in arguments. You're moving around. Even if all the argument and all the stresses are not going on, you just got up, moved, walked to the back, and then immediately they check the blood pressure. Your body actually needs time to settle down. Okay. Technically speaking, you're supposed to sit quietly for at least 5 minutes. And this ain't gonna happen in most clinics, right? Your feet are supposed to be flat on the floor. Your back is supposed to be supported, and your arm is actually supposed to be supported at the heart level. Okay. You're not supposed to cross your legs. You're not supposed to talk. You're not supposed to scroll on your phone. None of this. All this stuff, can affect your numbers. So stress, rushing, conversations, all this stuff can actually affect your numbers. Now, for most routines, like I said, clinics are busy. You're busy, so a lot of times it doesn't matter. It doesn't matter as much. But especially for those people that have a diagnosis of high blood pressure, or if we're trying to diagnose you with high blood pressure. These things become extraordinarily important because we want to make sure that we're not getting artificially elevated blood pressure readings. So make sure that you're following good techniques to get your blood pressure reading, especially when you're getting the initial diagnosis, or if you have a diagnosis of high blood pressure and we're trying to figure out whether or not the medications have controlled your blood pressure reading. So make sure we do that. Okay. All right. Okay. So like I said, so just make sure you're following good. Make sure you're following good techniques there. All right. Now, what's another one? That's number three. Number three. Let's drum roll, please. Right. So number three. So another thing, talking during your blood pressure reading can raise your blood pressure. So this actually surprised a lot of people as well. Talking, even casual conversation, doesn't have to be stressful conversation, can increase your blood pressure reading. Sometimes significantly dependent upon everybody's different, so it varies from one person to the next. So if someone is checking your blood pressure and asking you questions at the same time, the number may not be accurate. If someone is checking your blood pressure and you just got to get you got to get a question out of some nature, that number may not be accurate. So when we need these reliable readings, you're supposed to sit quietly, relax, and not talk during the measurement. Now, this not only does it surprise people, but for some people, it's very hard because, some people are not used to silence. They're not used to things being quiet. So when you're sitting there and, you're just sitting quietly with the blood pressure machine going off, some people are just not used to that comfortable. Now, sometimes the technique I usually tell some of my patients is to close your eyes and focus on your breathing. That helps people, especially extroverts, that just cannot stand the fact that it's quiet for more than 2 seconds. So that happens for some people. So if you're one of those people that you just feel like you need to talk, but you're getting your blood pressure reading, sometimes close your eyes, take some deep breaths while the machine is going off. So at least we get that accurate reading during that time. Okay. So that's number three. Number four. All right. Number four, weight loss really helps. Weight loss truly helps. And that is something I love to let people know, is that, when we talk about these, chronic diseases and the contribution of weight really matters when it comes to high blood pressure. And it doesn't take a lot of weight loss to affect your blood pressure, especially for some people. Some people are very weight sensitive, and you can lose 5-10 pounds and start dropping that blood pressure. For some people, the 5 to 10 pounds can be as powerful as adding another medication. Now, that could be a combination between the fact that you may be exercising a little bit more, maybe eating a little bit better, less less bad food, basically, and that's resulting in it. But the weight loss is associated with lower blood pressure in a lot of people. So yeah, so like I said, definitely focused on that weight. Okay. And if you think about the extra weight, your heart has to work a little harder. It's kind of like almost like carrying a backpack, except it's for most people it's going to be around the belly, and your body does respond to that. So like I said, don't forget about the impact of weight loss. All right. So now we talked about number one, talking about number two, talking about number three, hit number four. We're going to hit number five. This tip, energy drinks. Okay. And this one is for the young people. This one is really for the young people. Energy drinks can be dangerous. And I don't know, what the deal is with young people and these energy drinks, but really these energy drinks can raise your blood pressure. They can raise your heart rate. They can cause anxiety. And especially if you're a person that already has high blood pressure, this can be especially risky. They're not necessarily benign, I guess food products or drinks or whatever. They have caffeine, stimulants, sugar. They have all kind of things that are going on in there. And maybe if you just had the one a day, that's one thing. But a lot of these young people are drinking multiple of these, 2, 3, 4, 5, 6, 7 in a day. And it's like, this is not something you're supposed. When they designed that drink, I don't think they designed it for people to drink multiple drinks within a day. And then for whatever reason, it seems to be young people, that, they just, oh, I'm tired. Well, probably need to go to sleep. Stop going to bed at 3 o'clock in the morning. So yeah, so energy drinks can be, can be harmful. They can land people in the hospital, depending upon, their if the ingredients affect on your body. So, so be very cautious about that. And if you are drinking a lot of energy drinks, make sure that you have your own primary doctor, and tell your primary doctor what you're drinking. Okay, so let them know about those. Okay, so and the other thing is that can happen is this: that people are drinking energy drinks and they're drinking, all these other supplements, and they got caffeine, coffee, and they're drinking the soda, all this caffeine going in your body, extra sugars, and if you taking some other supplement that's got some sort of stimulant in it, all that stuff can be risky. It can raise blood pressure, it can cause heart issues, anxiety for some people, and depending on what's in some of the stuff, it might even damage the kidney. So be very cautious about these energy drinks. Let your doc know that you're drinking energy drinks, and especially if you're drinking more than one of these things in a day. Okay, so think about this for a lot of you, and then, like I said, especially younger folks, right? How many caffeinated drinks are you consuming each day? Okay, is it just a one? I can confess, I'm a one cup of coffee guy. So I mean, I just do that. Or you drinking five, like some people are drinking them throughout the day. And the same thing with energy drinks. Are you drinking are you drinking one a day, or drinking one a week? Or are you drinking the 4, 5, 6 every time several of them in a daytime? So those things, the amount that you're consuming can be very can be very concerning, depending upon your particular body's constitution. So we covered 5. We hit the halfway point, everybody. We hit the halfway point. Give myself an applaud. Thanks for staying here with me. Now, number 6, home blood pressure monitoring is important. Okay, home blood pressure monitoring can be important. Oh, we got a Sharice Stevens. Thanks for tuning in, and Christine, thanks for tuning in as well. I appreciate it. Thanks for asking those questions. So, home blood pressure monitors are important. So, the one reading in the doctor's office does not tell the whole story. Some people get nervous in the doctor's office, and this raises the blood pressure, and you can have something we call white coat hypertension. Okay, and then some people have normal readings in the clinic, high readings at home, so it can actually flip. Now, and that can be hard to detect, and this is why home blood pressure monitoring matters. So you get your own. So if you have a diagnosis of high blood pressure, or if you are concerned about a diagnosis of high blood pressure, say you got an elevated reading, but it was one-time reading, make sure you get a blood pressure machine and check your blood pressure at home. There are actually websites where you can get a list of blood pressure machines that have been reviewed or verified or meet the standards of the FDA. So, and I think what we'll do is we'll post this on the on some of our sites to make sure that everybody has access to that. And what you want to do is, you want to get your blood pressure reading. You can do what we call blood pressure log, which is, you're checking your blood pressure once a day, twice a day. You write down the date, the time, or just the date and, morning, afternoon, evening. You put those things down there, and you do that. You keep a log of that stuff and bring it into your doctor's office so that they can take a look at what your blood pressure is doing at home, what it's doing in the office. Like I said, a lot of my patients, I will tell them to bring the blood pressure machine into the office. I'll take the blood pressure with my machine, take the blood pressure with their machine. Hopefully it's the same or pretty close. That way I know that what you're getting at home is the same as what I'm getting in the office. And that helps me to be able to manage the blood pressure a lot better. Because like I said, there are some people that, their blood pressure at home will be pristine on, whatever medication is being I'm taking, whatever medication may have been prescribed. And then they come in, the blood pressure is elevated. Well, if I just had the blood pressure reading at home, I might give you another medication. I might increase the medication that you're taking. But if I look at the home blood pressure readings and on a cuff that's a good quality cuff, and they're reading well, I'm like, well, maybe you have white coat hypertension. But I can't make that diagnosis. No one can make that diagnosis unless they have the additional blood pressure readings in additional spaces. So this is one of the reasons why, if you have high blood pressure, you should have a blood pressure machine that you take home. Right? Oh, so we have crossed 6. We're into tip number 7. This one, take a deep breath. Meditation, meditation, meditation matters. Breathing matters. Reducing stress matters. Some people, honestly, I think the majority of people really, really, really underestimate the importance of stress. They underestimate what stress can do to a body. And there's acute stress, which is sudden. There's chronic stress when stuff is just going on all the time. And chronic stress can affect hormones, sleep, inflammation, blood pressure. And stress is important because it can raise that blood pressure. It can cause a lot of damage as well, but it can raise that blood pressure. And so sometimes you want to get a person to reduce the stress because that stress can lead to high blood pressure. So if you're coming in, you got elevated blood pressure, and no one's asking you if you're under stressors, that they may be treating, and not, don't get me wrong, because if you got bad bad blood pressure, even even if it's due to stress and you can't get rid of stressors, your doctor has to give you some treatment for that blood pressure. So get it down. There's also some other things that can be done, and that is you can do things like prayer, meditation, deep breathing, mindfulness, quiet walks. All of these things can lower stress levels and support healthier blood pressure. So don't get it. No, I'm not saying that meditation and prayer can replace medication, because there are a lot of people that want to try to do that. But meditation may lower that blood pressure. It may keep you from getting another blood pressure medication or something of that nature. And also, if you're under stress and meditation can't get it up under control because it's that bad, like I said, you will still need medication to get your blood pressure down. So at the end of the day, that reading is what the reading is. So now don't get it. Now there are circumstances where, maybe that deep breath and that deep breathing might bring that blood pressure down a little bit, and that's beneficial. But sometimes that's not enough. Maybe your stresses are too much, right? So it definitely needs to be part of a healthy plan. And sometimes, your breathing exercise can be really, really, really simple. Okay. It doesn't have to be anything complicated. So, as a matter of fact, we can try it right now. We can just, I'm gonna do it. We're gonna inhale slowly for 4 seconds. We're going to hold for 4 seconds, and then we're going to exhale slowly for 6 seconds. We're going to do this right now, and this is going to show you an example of a breathing exercise. And just notice when we do this, what I want you to do is I want you to notice the changes in your body, the changes in your mind whenever you do this. So, if you're somewhere safe where you can try this, I want you to try this. Okay, we're going to inhale slowly for 4 seconds. We're going to hold for 4 seconds, and then we're going to exhale slowly for 6 seconds. Okay, there we go. Let's give it a shot. Okay, inhale slowly, and then I usually tell people to inhale through the nose. Okay, so let's inhale. Then we're going to hold it for 4. 1, 2, 3, 4, and then we're going to exhale for 6 seconds. We're going to do it again. All right, so I want everybody to inhale. If you're at a safe place, you're going to inhale slowly through your nose for 4 seconds. You're going to hold it for 4 seconds. 1, 2, 3, 4, and then you're going to let it out. Okay. And so these are examples of breathing exercises that you can do. You can do them quickly while you're in the office. You can do them at home. If you're at home and getting stressed, sometimes you can do this. So like some kids getting on your nerves, or you got some relatives in your ear with some nonsense, or your friends not giving your money back and you're about to explode. Try breathing exercise. Just a real deep breath, like I said, in through your nose, hold it, out for 6 seconds, and do that a couple of times. See if you can feel your body relaxing a little bit, right? Okay, so we've gone through the lucky number 7. We're going to hit tip number 8, and that is that salt hides in foods that you don't expect. So a lot of times, your doctor, your clinician is going to tell you to do a low salt diet, and low salt diet, or eat healthy and stuff of nature. Salt in particular, salt and sugars hide in foods where in ways that you just you don't expect, really. Most of the salt in your diet is not coming from a salt shaker. Everybody's like, oh, I don't add salt to my food. Well, that's nice, but most of the salt that's in your food does not come from the salt shaker. It actually comes from processing. So, when you think about processing is designed to take a lot of food, process it in a way that it can last longer for shipping, for shelf storage and things of this nature. So it's going to come from canned foods, fast foods, frozen meals, deli meats, sauces, restaurant meals, even foods that don't taste salty necessarily can have high amounts of sodium. Okay, so the average American consumes way more sodium than what's recommended by the National Institutes of Health. They call it the standard American diet, which is all these sort of unhealthy additives and things of nature, and salt is just one of them. Sugar is another one that we consume way more of than we're aware of, and it's just because it's a part of our processing. Okay, so one thing you can do is you can look for low sodium foods or no salt added foods. And you also want to learn to look at labels, and that might be something we'll go over in the future. And that is, look at the labels and look at the sodium content. See how much sodium is inside of this, the foods that you're eating, because that is really, 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 really important. Okay, so make sure that you're looking at those sort of things. So that's number 8. And number 9, tip number 9, poor sleep apnea can be associated with high blood pressure. So if you're snoring loudly, if you're waking up tired, if you stop breathing during sleep, feel exhausted during the day, you may want to look into whether or not you have sleep apnea, because sleep apnea does seem to be associated with bad blood pressure. It's one of the things we actually screen for is to see whether or not a person has sleep apnea. And a lot of times you don't realize it, and you get this poor sleep, and that poor sleep keeps the body under stress all night long. Because remember, the way sleep apnea works, it's almost the equivalent of suffocating. You stop breathing, and then your body wakes itself up because you don't have enough oxygen inside your body. So that triggers that cortisol, and it's designed to kind of get your body to kind of shift so that you can breathe, so that the body can basically live. So, right. So the question becomes: are you sleeping, or are you just lying in bed in an uncomfortable manner? And if there is suspicion that you might have sleep apnea or poor sleep apnea, make sure that you get referred to a sleep medicine clinician so they can look into that, maybe get you screened for sleep apnea and make sure everything's okay. All right. And then, of course, tip number 10, last but not least, because I had to add it in here. I had to add this in here. I'm a kidney and hypertension guy, so I got to add this in here, right? So so high blood pressure damages the blood vessels that are inside of the kidney. And over time, this can lead to things that might be some protein in the urine. The damage to it can lead to reduced kidney function. And as that gets worse, you can wind up on having kidney failure or dialysis, right? And so high blood pressure, in terms of risk factors for kidney damage, diabetes is number 1. Number 2 is high blood pressure. So high blood pressure in and of itself can lead to damage to the kidney. So you need to make sure that you're getting that kidney function screen. Look for albumin in the urine, because those things can happen with high blood pressure, especially when it's uncontrolled. Okay, and then, like I said, and when it comes to this stuff, a lot of times the kidney disease, kind of like high blood pressure, does not have symptoms. You can't feel this. You can't feel your kidney function dropping. By the time you can feel the effects of your kidney function dropping, it's usually, you have advanced kidney failure. It's not early, it's advanced. Okay, so both high blood pressure and kidney disease can silently progress, and this is why prevention matters so much. This is why we emphasize in the show: get a primary care doctor, get a primary nurse practitioner, primary physician assistant, get somebody to see you do the screenings, making sure that you're doing okay. All right. So looks like we're out of time for the show. So I just want to give you some practical takeaways, and that is to summarize those top 10 things. That is, the cuff size matters. Rest before you getting your blood pressure checked. Don't talk during reading. Weight loss helps. Energy drinks can raise your blood pressure. Make sure you're monitoring everything at home. Reduce your stress. Reduce the amount of processed foods. Sleep affects blood pressure, and high blood pressure can cause kidneys. Okay, so what I want you to do this week, I want to make sure you check your blood pressure, and it could be at home. It could be in like a Walgreens or someplace that has those little machines that you can check it yourself. If there's a health fair of some of nature, get your blood pressure checked there. Share this episode with someone you love or somebody that you know that needs to check their high blood pressure, or maybe there's a family history of high blood pressure. Make sure they, or just screening in general. They need to increase their knowledge about high blood pressure. Make sure you share this episode with someone. Pick one habit to improve, whether it's eating better, exercising a little bit more, sleeping better, reducing stress, getting some good connections, all those things. Okay. Not all 10. You ain't got to do all 10. Just pick one. Just pick one, do one. Okay. Small, consistent changes transform your health. Before we end this, I want to just thank everybody that's tuning in. I really appreciate the eyes, the ears, the eyes and ears that are out there kind of supporting this show. If you like it, make sure you hit that like button, share with others that you can think of. I want to thank Dwayne, Cherise, and Christine for checking in on the show. I always like to know that I'm not talking to myself. It's always fun and things of that nature. So, but yes, so make sure you check out PressureMD Academy on YouTube. Follow us on Facebook. If you got actual health questions, www.pressuremd.com, www.pressuremd.com. Yet again, I always have to put the disclaimer out. I'm a doctor, not your doctor. So this is for education and entertainment purposes only. Well, we really appreciate you following us, liking, sharing, watching the recordings and providing comments. Really appreciate this. And for everybody, have a great day and a great rest of the week.
And